Welcome back to Washington Watch. I'm Joseph Backholm, sitting in for Tony today. A recent study by the University of Washington and Seattle Children's Hospital claimed that transgender care via puberty blockers improves the mental health of teenagers dealing with gender confusion issues. Now, on March 11th, a press release from UW Medicine said, quote, researchers recently found that gender-affirming care for transgender and non-binary adolescents caused rates of depression to plummet, end quote. As you might guess, mainstream news outlets leapt at the chance to glowingly cover these results. The problem is, that's not what the study actually found. Most significantly, researchers knew that wasn't true, but when they learned it wasn't true, a series of emails show they decided not to correct the record. So what did the research actually reveal? And is this normal behavior among the so-called experts? Joining me now to discuss this is Dr. Jennifer Bauwens, Director of the Center for Family Studies here at Family Research Council. Dr. Bauwens has extensive clinical and research experience working with survivors of trauma and abuse and is also taught on psychological trauma and research methods in several graduate programs. Dr. Bauwens, good to see you today.
It's good to be with you, Joseph.
There's a lot to discuss, very little time. Let's start with the study itself. We know what their press release said. What did the study actually find?
Right. So the interesting thing here is that we're facing the same study, same type of study once again. There is such a valiant effort on people who are for this transgender ideology to really find something to hold on to promote this way of treating children. And once again, we find that there's some funny business going on with the way the scientific study, quote unquote scientific study, has been promoted. And what we actually found is, like, the study says that if you take puberty blockers or hormones, that it will actually reduce your negative mental health outcomes such as depression, anxiety, suicidal ideation. But when you actually dig into the study, what we're seeing is that the result is not significant. And but you know, the narrative fit all of the mainstream media, so they ran with it.
And to that point, they actually learned that, and they, in their private conversations, they admitted this. Now, Laura East is the Department of Epidemiology spokesperson, and there were several emails that were requested through a Freedom of Information Act request about this study. And here's what she had to say to her colleagues in some emails. She said the article, referring to the study, said the article resulting from the inquiry was recently posted on the author's Substack and includes some pretty concerning claims. UW Epidemiology, UW SPH, UW News will not be including this article in our media tracking or otherwise driving traffic to this piece. So this right here is their acknowledgement that there is something wrong with this study, but the emails go on. And here's another quote from, again, this is Laura East. She says, quote, as there is an overwhelming amount of positive coverage of the study's findings, I don't believe there's a need for a proactive response beyond continuing to monitor. But welcome your ideas for any other actions or messaging with the study team. Happy to jump off on a call if that's easier. So she appears to be saying here, Dr. Bauwens, that we're getting a really good response to this study. It has some very concerning claims, so we don't really trust it, but the press is so good, we might not want to correct that. Is this normal behavior within academia?
Well, it didn't used to be normal behavior, at least that we know about. I think COVID gave us a different opening into the scientific world when you have someone like Dr. Fauci who claims to be science, in which case we know that science has gone off the cliff because we can't really trust Dr. Fauci, and if you do, then we might have a helpline for you. I'm all kidding aside. We have to look at some of the things that we know about the scientific method, which are we're transparent. We hold findings loosely. We don't use polemical language, such as plummeted. Our study showed that the results are the outcome plummeted depression. We don't use that kind of language. And if you read studies like that for our listeners, that should be a clue that something is going on in the reporting, that my alarm bells are going off. The access to the raw data. Anyone should be able to write to a researcher and say, I'd like to see your data, I'd like to reanalyze it, but you don't see that happen here with this particular study. So what we're seeing, not just with University of Washington, but American Academy for Pediatrics, and other studies that we've reviewed on this program, is that there's such a politicization of scientific method. And when you don't see the basic method adhered to, then we already know we're in troubled waters here. We cannot trust the results.
Dr. Bauwens, one of the other interesting points about this story is that the news outlets who ran with this, which includes some of the big names that we know of, they saw this headline, they grabbed it, and of course they promoted it. It took an independent journalist to start digging in, asking questions, asking for the data that supports the findings, which the University of Washington refused to release. Is this also an indictment of our news media, that it takes just kind of quote unquote regular people outside the media establishment to ask the questions that ultimately let the world see this isn't actually true, and the legacy media, the established media, the so-called credentialed media, were just running with the headline that they were given and weren't thinking critically at all about what was being claimed?
Yeah, and what a sad state for treatment, because you remember, we're talking about children. We're not talking about somebody getting a toe surgery or something, rather benign. We are talking about the lives of children who will forever be impacted by these quote unquote interventions. Yeah. And then also, you look at this study and you see the kids who are enlisted in it are already having significant mental health problems before they even are treated by a quote unquote, again, physician. So, right. This is problematic on so many
Dr.
fronts.
Bauwens? Yeah, and we know that there's problems associated with stopping puberty and cutting off body parts. But this study tells us that there's not even the other benefit to mental health. We're out of time. Gotta go. Thank you so much for being with us today.
Thanks.
This is a